Hello everyone and welcome to this audio podcast. This audio podcast is part of a ZtormLabostix article. This audio podcast is part of a Bellow and Raw. This audio podcast as part of a Chrome edition. This audio podcast as part of a ZtormLabostix production. Now looking at the some of the neuropharmacology around myasthenia, and to iterate here, listeners and viewers, that the neuropharmacology in around myasthenia, in around myasthenia like conditions, the neuropharmacology would have varied over and in amongst the literature. However, treatment of myasthenia is with and has been with anticholinesterase pharmacotherapy and immune therapies. Pharmacotherapy, including pyridostigmine, is has been has been has been has been has been has been used in as a pharmacotherapy in myasthenia. Pyridostigmine is a long acting, or has been is pharmacotherapy, which is a long acting cholinesterase inhibitor with onset action beginning around 30 minutes after administration. And during of about has a duration of around 2 hours. Pharmacotherapy doses of pyridostigmine should not ordinarily exceed 120 milligrams every 3 hours, and anticholinesterase can worsen muscle weakness. Additionally, corticosteroids are often used in myasthenia, and there is an improvement in around 70. Has been documented that there's been an improvement in around 70% of cases, although this may be preceded by an initial relapse. Certain pharmacotherapies also exacerbate symptomologies of myasthenia, which include sort of antibiotics, specific sort of antibiotics, narcotics, penicillamine, magnesium, anesthetic agents, muscle relaxants, and pharmacotherapy is also used to treat arrhythmias. So that draws this audio podcast to a close. This audio podcast is part of a ZtormLabostix article. This audio podcast is part of a Bellow and Raw. This audio podcast as part of a Chrome edition. It's part of a Chrome edition, and this audio podcast is part of a ZtormLabostix production.